Good morning and thank you very much for joining us. I am Yori Folani alongside Asukwo James, TVC News Editor. Good to have you.
Yeah, good morning.
Indeed.
Good morning, Nigerians.
There you go. I never say good morning, Nigerians. I don't know why. Maybe it's because I know that...
Should you say good morning, the world?
I just say good morning, and wherever you're in,
Yeah.
it means you're getting my good morning. But anyway, good to have you back again.
Thank you.
Now we're looking today at COVID-19, which it's been in the air. We are actually in a gradual reopening of society, and I think we were speaking about the fact yesterday, day before yesterday, just about every day. Experts are saying they're not very pleased, and we shall discuss that about the degree of compliance of those of us in society. Have we relaxed a bit? Do we not think it is as imminent a danger as it used to be? Are we keeping all the rules, all the advice we've gotten about social distancing, about all of it, about washing hands, about every single thing? It looks like we've relaxed a bit, and maybe world affairs haven't helped very much. Look at the situation in America. Look at the crisis they have in America. How many people are actually observing social distancing in the protests that have been going on ever since the unfortunate story of George Floyd broke? And it's caught on all around the world. So it's unfortunate that this kind of a thing went and happened in the middle of this pandemic, because everything that the experts have been telling us, in the emotion of the moment, we've sort of thrown that overboard, and we're coming out to express our opprobrium to about what happened to George Floyd. Thereby compromising the message further, which is that we need to maintain social distancing. Take Abia, for example, back home in Nigeria. Abia State had very low, for the time it didn't even have any, and then it had low numbers, and suddenly there was this spike. So much so that we even are hearing that the governor might have decided to isolate himself. One has to be careful about that. I don't know if you have anything, you being an editor and all.
Yeah, it tested positive.
There you go. You can say it. He actually tested
So
positive. And look at the numbers now. Total confirmed 13,000, almost 13,500. And then you look at the numbers discharged, and then the deaths. And the worry is that we haven't noticed these numbers coming down. In fact, there are situations where, following the gradual opening up of society, numbers have spiked in certain areas. So we'll look at all of this. But before we get into this proper and look at how society is actually relating to this opening up of society, we need to go to Kano. And our man, he's standing by, Ibrahim Issa, TV news correspondent in Kano State. He's standing by. Good morning, Issa. I'm sure you can hear me. Maybe there's something of a delay, but because we've spoken already. Great to have you on, Issa. Now, I wanted to talk to you about the revelation, or shall we say the explanation now that we have that the strange deaths, so-called, in Kano State, and government in Kano was not too keen for people to be attributing it to COVID-19. Now, we actually have information that more than half of those cases were indeed due to COVID-19. Could you take it from there, please?
Well, there's a noise in the background. I hardly can hear your question straight, but talking about the mysterious death in Kano State, sometimes in April when Kano had witnessed the unusual deaths, there are lots of attention on the state, and lots of concerns from residents. Then the federal government, through the Ministry for Health, sent a team. They call themselves a ministerial task team on COVID-19 in Kano. They came in to work closely with the government and investigate the causes of the death and then mitigate the problem. So when they came in, they had to do one or two things, a preliminary investigation, and then the team lead, talking about Dr. Sani Gwarzo, had an interview with some journalists. I happen to be one of them, and then we asked him how true is those unusual deaths. Are they really connected to COVID-19? And then in Hausa dialect, he revealed that they are likely to be connected to COVID-19, even though not all the mysterious deaths are connected to COVID-19. He gave about 5 reasons why he thinks, or the team think, that the unusual deaths are connected to COVID-19. One of it is that uh, they gave options that looking at the number of deaths that had occurred, they compared it to those deaths that are happening around the world, and then the cycle which the death occurs. So many reasons were given at that moment, and then later on we came on to understand that he was misquoted by some journalists by saying that all the deaths are COVID related, and then that information was retracted by him. And then yesterday or day before yesterday, the minister came out to say that half of the number of deaths in Kano State are COVID, may likely be linked to COVID-19, mentioning about 1,000 deaths that had occurred. You know, when Kano was witnessing such, there are lots of measures that are actually been put in place by the government to mitigate the problem. One of which is the working closely, the putting together the RRTs and then all the medical professionals that are actually linked to the fight against COVID-19 to visit those graveyards, to investigate by engaging those grave diggers on the numbers they see usually every day. And I also happen to visit those cemeteries, and I had engagement with those eyewitnesses who are close to the cemeteries, and they give me figures which actually shows that yes, there had been mysterious death, and then the government came out to also address that those deaths are not linked to COVID-19, but they are linked to diseases like acute malaria, typhoid, hypertension,
Meningitis.
and so on, and meningitis. Yeah.
Okay, I was asking if Asuko had a question for you, but I want to thank you very much for giving us that sort of a leg up. But just before we go, a brief one, because people are saying following the easing up of society, the gradual reopening of society, people are sort of going overboard and are carrying on, according to some observers, as if there is no emergency. What's it like in Kano? People talk about carelessness, carelessness in wearing face masks, in social distancing. What's your experience in Kano? Are people still taking it as an emergency, even as the society is opening up in Kano?
Well, you know, Kano has a population of more than 10 million people, and this population actually happened to be the reason why COVID-19 had spread, and then the communal transmission of the disease, which the state is currently facing, actually came in force. So some people actually believe that coronavirus is a hoax, and then the government is working tirelessly to sensitize those people that believe the coronavirus is a hoax. So recently, Kano is witnessing a decrease in the number of cases. Yesterday, about 12 or so numbers were recorded, and then the state had also been recording 0 number of cases. And it is now, even though Kano is still the number 2 in terms of the number of cases of the coronavirus, Abuja is now becoming closer to Kano. So if at all in the coming days Kano had not witnessed any case, Abuja will become second in the number of cases. Testing has also been ongoing, but the states witnessed low number of cases this day. So looking at the way Kano is having a low number of cases, residents, and looking at also the lockdown that had been imposed and the easing of the lockdown, residents are going on with their normal hustle and bustle on Wednesdays, Sundays, and then Fridays, but adhering to the protocols of health professionals.
So in terms of preparations by the government, how far have the bed capacity been increased? Testing, has it been increased so far? At least so that even if anybody is infected, there should be a bed space for the person. Or are the bed spaces just empty?
Well, some bed spaces are actually empty. Places like the Sport Institute, where the government had currently converted into isolation centers. You know, Kano had lots of bed spaces even though the Sani Abacha Stadium, the one that the viral video was sent, that it hasn't been completed, but initially the place has about 500 capacity, but 200 are now being fixed there. So 300 beds were taken to other isolation centers like Daula Hotel, Abubakar Urology, and then the Sport Institute. So there are lots of bed spaces. The Kwanda Dawaki Isolation Center has about 72. Gikinyu also have bed spaces. And looking at the low number of cases nowadays, you'd actually imagine that Kano would have much bed spaces, since there are lots of discharges currently ongoing in the state.
Now, in terms of, you said something about people not believing that it's a hoax. And what is the government doing in terms of sensitization? Because just like you said, the mysterious deaths, bringing the numbers to more than almost 700 plus, because it wasn't even included by the NCDCB, which is normal, because it's only when the samples are tested and if someone dies in the isolation center. So what is the government doing to sensitize people so that people understand that COVID-19 is still there and we have not reached the peak?
Well, first of all, the government decided to take the campaign to the 5 emirates of the states, the 5 first-class emirs who are engaged by the government. And then also there are traditional rulers like the ward heads and so on, because the government believes that those people can actually talk to their own people. They know whoever is living, they know the market leaders, they know everyone that they can quickly talk to, and then those one can actually talk to others. Then the government is also using the local radio stations to produce jingles to sensitize the people on what they need to do, and for them to also believe that coronavirus is actually a reality. And the government has been saying frequently that coronavirus is a reality. Recently, the government had also engaged market leaders and then so on, so that they would also go back to the markets and then inform their followers that this is exactly what the government wants. This is exactly how true coronavirus is, and the reasons why they have to abide by those protocols of health professionals. So there are lots of engagement in Kano State. The government is working tirelessly to ensure that the people believe that coronavirus is real and it is not a hoax.
Well, I want to thank you very much, Isa. Thank you very much for coming on and sort of bringing us up to date. I said Isa. I should have said Ibrahim. You being Ibrahim, Isa. Thank you very much for cluing us in. Okay then. So we'll take a break. Please stay with us. We'll be right back, and then we'll expand this question and also commentary on it. Are we going overboard in our freedom? Nobody liked being cooped up, no matter the immediacy of the reasons. But stay with us. That'll be our focus when we come back. Okay, welcome back, and thank you, Dr. Tui Mebawadu, public health practitioner, for staying with us. You must have been listening to our man in Kano there. And so, Dr. Mebawadu, I want to talk about the wisdom we're getting from scientists that, look, and maybe you can explain it to us or for us, this second phase that they say will hit, and they're saying this around the world, people are just coming out of of restrictions, and now we're being warned not to really go overboard because the curve hasn't flattened yet. Could you explain that to us? How worried do we need to be that there might be a second phase of COVID-19? Because it looks like we've got sort of jaded and it doesn't scare us as much anymore.
Yeah, thank you. Now, when the COVID-19 pandemic broke out and we have to insist on lockdown, what we're saying is that because since we're going to need human beings to transfer the virus, to spread the virus, once you lock down, the rate of that transmission will be reduced. Now, that you now see the first phase of the pandemic as it affects Nigeria. Now, if you look at that first phase, you see that as at end of February, we had 2 cases. By end of March, we had 315 cases or thereabout. End of April, we had 1,000, let's say about 2,000 cases. And by the end of May, we have 12,000, about 12,000 cases. So you can see the progression, the geometrical and astronomical progression. So the first phase actually was telling us, stay at your home, don't transfer disease, let us look at where we are. By the time you start opening up the economy, by the time you start opening up the country, you are going to see a new wave. Some asymptomatic carrier will interact, some people will transmit it the more. So now, what the new wave will now tell us originally where we are, to the level of penetration of that disease in the community. In fact, it could be a second phase, a third phase. We just hope that we won't get to a point where we have to lock down the country or the state again because of escalating numbers. And if you look at the numbers as well, since February, when we had the case, we've seen from 2 to 315 to about 2,000, now to 12,000. If you project that, and even yesterday alone, we had the highest increase in the whole spectrum of the COVID infection. And that's, we have 663 cases, even added to the number yesterday. So we see that as we open the economy, as we do more testing, we're going to have the real situation. We're going to really understand where we are in this phase. So that is what the second phase is all about. Now, at the second phase, because we don't want it to get too bad again, at the second phase, we don't have to let down our guards, because now we're seeing people interacting with themselves. We're seeing the pandemic really showing intense community transmission, because that's what we are now. We're having intense community transmission. The intense community transmission will tell you exactly what is happening in your community. And that is why we're seeing that the cases are rising gradually as we test.
In terms of reaching the peak and the community transmission that you just said, by the time we open, how do you want people to, to see this as being real? Because so many people don't believe it's even real. By the time people start going to work, people start going to already started going to market. So, but by the time real life starts, won't it be very difficult for the government to tell people that this thing is real?
Now, not just in Nigeria. You see that governments all over the world, majority, they are giving up on COVID-19. I'll give you clear examples. For instance, look at America. From pandemic to protest, you see the large number of people that came out, and then, of course, you are going to see an interesting time will come out from those experiences, as it were. And the protest is not just localized to America. It went right across the Atlantic and gone everywhere, maybe except China, where we're not seeing protests, or Russia. And apart from that, we saw the protests everywhere. Now, even the head of COVID response in the White House is returning back to his normal job. Anthony Fauci is going back to his normal job. Yes, he's going back. So you're see that even America is getting tired of the challenge of COVID. And of course, Nigeria case, you see, government, the presidential task force on COVID-19 said that, listen, states.
Okay, while the doctor is getting back online, in addition to what he is saying, I wanted to really get him to talk a bit more about what he referred to as intense community transmission. That is the phase that we are now witnessing. And I want to combine that with asymptomatic cases where no symptoms at all. Even if you test them, nothing. But they can still transmit. That boogie right there is quite scary, Dr. Mebamodu. I understand you're back.
Hello.
Okay, Dr. Mebamodu, thank you. Okay, I went back to something you said that we are now in the phase
of
what you refer to as intense community transmission.
I had you.
Yeah, okay.
Now,
and when you combine this with the shall we say the innocent carriers walking around, people who are not showing symptoms but can still transmit, it makes it a real scary story.
Indeed, scary. Not just innocent carriers, what you call asymptomatic people that can transmit. Yeah. Intense community transmission, asymptomatic people, and secondly, a lot of doubt as to whether COVID-19 is real. In fact, you see police stopping you on the road when you say you're a doctor and say, are you sure this thing is real? You see a lot of doubt. We've not been able to manage information very well. So inability to manage information has led to what I call misinformation and disinformation. And some of them are actually trying to weaponize, a lot of issues concerning people. So now, what do we do? And then we're now seeing a situation whereby government is saying that, wait, we're going to be isolating people in their houses, in their community. You want to ask the question, where are the houses to isolate people? Except you are now categorizing houses and looking at different areas where we can isolate cases. Now, so what we need to do is to brace up for, challenge. It may happen, it may not happen, but it's better to get prepared for it than to wait and than to be assumed that it won't happen and it happens. Now, data that will come from America in the next 2 weeks or so will be quite interesting because we've seen people breaking the so-called strict rules that we've imposed since the onset of this COVID. Now, even in Nigeria, we've seen that even the interstate travel ban has broken down. All other things that we've said, wear face mask, is only when people want to enter your office that they wear face mask. After that, the face mask is off. So people are, with all the rules that are supposed to protect them, we're breaking it down. The next few weeks will actually be a huge challenge for us.
Indeed.
So in terms of the intensity of the new cases we may see.
Because one other thing that one is reading and hearing the news about in other countries is where the medical experts are advising people to take responsibility individually and in spite of the easing up, not go out if not entirely necessary. But then, the psychologists and the sociologists get in on the matter. They begin to divide the thing up into age groups and how some people are really, being cooped up. Psychologically, there's a problem. I've read somewhere where they say there are more rapes in this period. There is more depression in this period. Some age groups are more susceptible to social isolation than others, and so it's a nightmare. So as a metaphor, in terms of how to continue, this is not the time to resume our social calls like I've got to go visit my cousin who is in the next town, those kind of things. And these are the very things that people want to do, having sacrificed the way they see it by being cooped up for the past 4 weeks to 8 weeks. And this is really a headache. At the end of the day, they're advising that people have to take individual. Don't bother yourself with what anybody else thinks. If you care to know the science of the matter, then you know that you have to carry on with great caution. Don't just open up and say it's time to party.
That cannot be overemphasized because we need to really deepen that communication, that aspect of communication. Now, it's not Uhuru yet, it's not Uhuru yet. Even from the data we're saying, it's not Uhuru yet. And then, what do we do? Okay, now the shift to individual responsibility happened the first day. And we chose to say, okay, we're not going to do lockdown. It shifted to individual because at the end of the day, when we had a whole month to do the communication, I think we missed some gaps there. So now, because we look at Nigeria, you're not having enough bed spaces. maybe the government just notched up to the isolation case, best cases to about 5,000 now. And already we're having about 12,000 or 13,000 cases. You can see the gap. If we have like half of those people having severe condition, we'll be in big problem. So as much as possible, the most important level of functioning will be at an individual level now, where you have to take recharge, and look at it as a matter of life and death. That you see, as much as you want to protect your livelihood, you don't want to compromise your life. So you look at it, what can I do personally? And that ability to strengthen your personal intervention will go a long way to relieve the government of the burden of bed space, to ensure that we don't have overwhelming cases on medical facilities. Indeed. So individual, and then what do you need to do? Simple thing. Promote, we have to really top-notch your hygiene, including respect. You have to avoid crowd. You have to use face mask. You wash your hands, and then unfortunately, if the internet thing is working very well, we should be able to order food, and they will come and drop it on your front door, and you pick it, and that's it. So we have to, as much as possible, wait this time out. Waiting this time out means that we're looking at it that, by August, how are we going to be? So if you can get this through by August, we'll have a clearer understanding of how to deal with this virus. Because the vaccine may not come as early as possible. So it now boils down to individuals. So the government needs to improve information and discussion at that level. What's happening to individuals? What's happening to communities? To structure and look at it that, listen, in this community, in this local government, what are their risks? Because if you have overcrowding in a place, if you don't have health facilities in a place, if you don't have water and sanitation in a place, that the risk there is high, not just for COVID-19, but for a lot of infectious diseases. So you look at stratify those things and find out that, listen, what you're going to do is that this place is a high-risk place. Well, this is the additional thing we can do. But this is a low-risk place. This is what we can do to prevent the low risk from becoming medium or high risk.
All right, then. One moment, Doctor. We've been joined by Mr. Yakub in Dokwemo. Good morning.
Yeah, good morning, sir.
Thank you for calling
and, good morning to your guest, Mr. Mibanwodu.
Dr. Mibanwodu.
Good morning,
sir. Good morning.
Chief Jory, you see, for me, we are already in a big problem, quote unquote. As Asuko said earlier, some people doesn't even believe that this thing exists. Sometimes, if I have opportunity to go out sometime, some people will be telling you that government is using this thing to make money. Now, the question I normally ask them is this: Do you think that government is okay by closing the university, by closing all the secondary school down, including the government agencies down? So you are not telling me that this thing is not exist. Usually, you know why? Some people even say that, why are they not showing us in isolation center so that we can be able to know that this thing is existing? And then when they manage to show some, you will see the people carrying this virus in isolation center, some of them will be dancing this. It's not because they don't have it. They really have it. It's because that their immunity is so high to the extent that it cannot bring them down. That's
all right, then.
Number two, Chief Jory, I can always blame our government. Why? They are telling us to watch our hands. Chief Jory, common ordinary water. Indeed. We cannot find it in our streets.
Thank you very much, Yakub. I take your point. Thank you very much, and also for the encouragement. Stay with us, please. We'll be right back after this break. Okay, welcome back, and still with Asukwo James, and Dr. Mibanwodu is on the line, and we're looking at our behavior. How well we are doing in terms of protecting ourselves from COVID-19 by how we behave. And we've been hearing from the beginning of this program that a lot of the challenge is that people not seeming to understand or believe that it is as bad as scientists tell us that it is. And we've talked about the curve hasn't flattened yet. And so it's not yet uhuru, to use the words of Dr. Mibanwodu. So the problem, the other issue that is of concern, of course, is that because of all of that, there will be a slackness in individual zeal to do that which needs to be done. Look, it's a sensitive subject, but we do know that religious houses are pretty dangerous places if not well managed.
Exactly.
That's where, and you know, we've had that discussion,
And
so we don't want to go there.
And if not being well managed is relative, because how do you define well managed?
Well, you know, the whole 2 meter distancing.
They are saying 2 meter. There's a,
yes, the fast face masks.
That's what we are always saying.
Which some people are saying won't work for them.
What of when the service closes? What happens?
There you go. So there are all those kind of problems. I think another caller has come in. Olaiton in Aja. Good morning, sir.
Good morning, Mr. Yoris.
Thank you very much for calling in.
And Asukwo.
Yeah, good morning.
And Dr. Thank you for your awesome things you are doing on the program. My contribution is, it's apparent that this is not, it's only getting worse. It's apparent that we're not getting to the curve. No, flatten the curve. It's apparent that we must still be extremely cautious. So I'm wondering, where will government continue to open up in the midst of this painful increasing numbers, showing that we are not getting better? I am wondering, and I'm really concerned. I mean, I'm hearing you and Dr. talking what we all know, that it's getting worse, and we must curb, we must arrest this increasing transmission. Now, but government seems to be doing lip service. I commend some governors clearly, Lagos State governors inclusive, but we must have a national outlook to how we aggressively deal with this pandemic.
Okay, thank you very much, Olaiton. I got to interrupt you now. Forgive me for doing so, but thank you very much. That's the essence. Dr. Mebaudu, if you had to pick up here, the figures are actually, you know, Olaiton was saying that it's clearly an emergency. But it's even more of an emergency, it's worse than the figures are indicating. Because people like you, experts like you, have told us that if only we could test wider, then these numbers would be scarier.
Yes, exactly. You know that, you see, now when the federal government said that, listen, we're going to hand over the control of COVID-19 to states, I shouted that that's not proper. Because a state will figure it out that, listen, I want to give chance to some church or religious houses and mosques to open. Some states will say no. And then when those states that chose to do that, to give them chance to open, when the cases are corrected, you cannot stop them from moving to Lagos. There are no boundaries. Now, we know that this is like an iceberg phenomenon, where only 1/8 of its part is visible, and the majority of the part is the water. Because now, even the testing, let's clarify the testing. The testing does not mean individual. Say we've tested like 70,000 now. We're not saying we've tested 70,000 individual. A test can be repeated on one person like twice or 3 times. I would count it as a test. Okay? So the figure we're parading is far, far lower down. Now, look at how much Lagos State, for instance, have spent on testing. More than close to 800 million. That is a lot of money. So again, now if you're going to up your testing, that means that you are looking for a huge amount of money to do that. So, well, you have to test for you to have a clear understanding. At least you must make up to at least 1% of Nigerian population to test so that you know. But since you may have challenges with that, all you need to do is to structure and do a risk assessment of each local government, each community. You know, on our table now, we must be looking at it. What is the risk assessment of, say, Kosovo local government, or Badagi local government, or Ekpe local government? Where are the hot spots there? What do we do at those hot spots that can then reduce the incidence of transmission? So, you know, and you saw, even a state of Israel chose to open schools in the past weeks. They had to close the schools back because
okay, one moment, sir.
Skyrocketed.
One moment, sir. I was waiting for you to reach a point I could, you know, sensibly cut in. Thank you very much, Dr. Mebaudu. Please stay with us. Mr. George has come on the line. Apologies, Mr. George, for holding you up for a bit.
Thank you, Uncle Yori. Uncle Yori, I do not see this exercise succeeding without the cooperation of our leaders. Look at what happened in Kano. Government decided to lock down Kano because of the surge that came up from there. 5 days later, the governor of the state was calling for a relaxation, just in 5 days, because he says people are fasting and all that. Governors came to Lagos for political purposes to meet Bola Tinubu when there was no interstate movement. These are our leaders. If people are seeing them like that, how do you think the average person will take this issue of COVID-19 serious? So if the leaders want us to obey it, they should first obey it. That's what I expect to do, and that's why many people do not believe that it exists.
Yeah.
So that's just the reason, and charity should begin from those who say they are the ones leading us. That's just what I want to say.
Thank you very much for calling in, Mr. George. And I want to re-emphasize that just like Mr. George is saying and everybody is saying, Dr. Muhammadu, government is not leading by example. At the end of the day, we can't miss that point about personal responsibility. It's like how we wish that we could get people to understand that never mind about government, never mind about those leaders. If they want to remain irresponsible, quote unquote, my life here, but where will they believe? My life, I am the number one defender of my own life. Yeah, government will come and back up, but surely, if government is going to do its bit by preventing poison, it is my duty not to pick up a bottle of poison and drink it wherever because government is not looking. You know that very sketchy metaphor. What are we doing for ourselves? And it goes back to the problem that people, for some reason, don't believe it. We heard somebody say that, oh, it's a ruse by government to make money. Well, if you continue to believe that kind of a thing, you're not taking personal responsibility. And at the end of the day, it's not government that's going to, God forbid, die. It's the individual. I think we have someone else on the line.
Yes, Joshua.
Oh, Mr. Joshua, good morning, sir. Thank you for calling in.
Good morning, Uncle Yori. How are you, sir?
Very well, thank you.
Quickly, I just want to say this pressure to open up religious houses,
yes,
I think should be done away with in this period. Most of the analysis we are having now, I want to tell you, is from religious leaders. That COVID is not real, COVID is this. All those theories are from our religious leaders, and they spread it to their members. The more they have opportunity to reach their members, the more they tell them their faith will heal them, God is able to do it, COVID-19 is not true, and then we have spikes in the society. There's nothing essential about religious gathering. Let's tell ourselves the truth. Let's save ourselves this embarrassment of opening up religious houses. Close them down. If there's anything essential at all, it should be schools, not religious houses.
Okay.
Enough is enough.
Okay.
Let them.
Thank you very much for calling in. It's an important subject that Mr. Joshua brings up. Dr. Muhammadu, we've had this conversation. We appreciate that it's a delicate subject, but nevertheless, there is this scientific aspect to it. There's everything to be said for faith, of course. Nobody should get anybody wrong. But the facts of transmission that experts like yourself continue to emphasize cannot just be looked away from. And I don't want us to dwell too much on the religious aspect, religious houses, because I think Mr. Joshua has made the point, and it's a very sensitive subject. But we get on with the business of how society at large will recognize its responsibility to itself. You're not obeying because you want to be a good citizen. You're not listening to what Dr. Mebao do and Dr. Boyo and all the other practitioners are telling us because you want to be a good citizen, but hopefully because you wanna do your best to stay alive. That, I think, is the trick. How are we gonna get that across to the people, Dr. Mebao? I think that's what the administrators.
Indeed, Sayori, you've actually emphasized the thing. You know, what makes up religious houses? Individuals. Whether church, mosque, or individuals. So if you have a proper understanding and perspective to these things, As an individual, you choose that for now, I'm not going to attend church. I'm not going to attend parties. I'm not going to attend this, just to make sure that you keep yourself safe. So the first response is at the individual level. What are you doing personally to ensure that you're safe, to ensure that you survive this and keep yourself, and not transmit the disease to another person? So we need to emphasize that. Now, what we should also be doing at the level of government is to enhance the individual choice in such a way that it becomes easy for individuals to take those decisions. Because, see, if you don't enhance the individual within the community to take those kind of decisions, they will look other way and a lot of things will happen. And let's be clear, let's be frank about it. There had been a yawning gap at the beginning of this whole exercise, because the critical stakeholders are supposed to involve. The opinion holder in the society, they have a huge number of followership. You were not involving them. You didn't give them rules to do in terms of this prevention.
Indeed.
Prevention is the key thing. If you had given, for instance, the head of Asaruddin a clear task to do in this COVID and let him be part and parcel of your process and how to reopen the place, you would have gotten a huge success.
Okay.
If you had given the head of, say, Redeem or whatever, that kind of role, you would have gotten a huge success. But it is not too late to go back to that kind of thinking.
Okay, one moment, Dr. Muhammadu. Femi has called in from Ibadan. Good morning.
Good morning, sir.
Thank you very much for calling in. Please go ahead.
Uncle Yori, I appreciate the good work you are doing there.
You're very kind, sir.
The way
Thank
you
you.
handle this subject. I have a question which I want you to please ponder upon and answer, because to me, we've been looking at this COVID-19 only from one dimension. As of yesterday, we have 365 fatalities, 365 deaths. In 100 days, or over 100 days, we have over 13,000 positive cases. My question is this. If United States of America has 365 deaths in 100 days, or United Kingdom, or Spain, or Italy, if they have 365 deaths in 100 days, will they shut down their economy? Will they shut down their aviation, shut down transportation, close their schools, close their churches? If all they had was just 365 deaths. I believe COVID-19 is real, killing people all over the world, but I also think the variant of it we have in Nigeria, we are over hyping it. We shut down the hospitality industry, shut down aviation, shut down the economy, shut down the church, and every other place because we have 365 deaths. When the thing first came, I understand the panic, the anxiety. But having watched it for over 100 days, and all we have is 365 deaths.
Could I ask you, Femi,
where we cut a pace, we not shut down the economy.
Femi, could I ask you a question? Can you hear me, Femi?
We wouldn't even have it. Hear it.
Oh dear, Femi.
Femi. I think we have enough. We have watched it enough.
Femi, can you hear me? Femi, can you hear me?
Okay, I'm hearing it.
Oh, okay. I wanted to ask what you thought, because this is an important point that you brought up. I wanted to ask what you think about the notion that the 365 deaths that we are talking about here and the other numbers that, that are related to it, experts have said, and you compared it with the UK, the US, the number of deaths, and the question you asked, but our figures are a slight percentage, comparatively speaking, with what they have over there. That is to say, to make myself a bit more clear, that is to say that they probably are able to do a wider, slightly more accurate kind of testing. Now, the one when reach our hand, as our people say, so to speak, has produced the figures that we are saying.
Yes, it means the figures should have been higher.
So if we had had the kind of scope that the US, New Zealand, and all those other places, Germany had, we could theorize that maybe that 365 deaths might easily be 10 times as much.
Yes.
And Would you want to factor that in? Do you think it is intelligent to factor that into the equation here?
Yes, yes. Well, we are said not to be testing enough. That if we test, okay. Oh, am I on air?
No, you're still on air. Please,
Okay.
briefly answer me, please, briefly,
we are
so I can go to
said
Dr.
not to be-
Mebamadu for his comment.
Yeah, we are said not to be testing enough.
Yes.
That's why we are not getting much more. We are not getting much more positive cases. Are you hearing me?
Yes, we can hear you.
That we are not testing enough.
That's what
why
we say.
we are not getting more positive cases.
Yes.
My question is, if we are not testing enough, then it means the COVID-19 is spreading. We are potential positive people so much in Nigeria. Then within 14 days, 21 days, we should all be dead. Just like Mrs.
Okay, thank you very much, Femi. Thank you very
dead.
much. I appreciate your call, and I've had to abbreviate it like this, and we can extrapolate the rest. But your main concern is that, whereas you believe, Femi believes in Ibadan, believes that yes, COVID-19 is real, but there's a sense in which we might be making something of a mountain out of what is actually no worse than perhaps a large molehill. Dr. Mebamadu. Dr. Mebamadu, would you like to comment on?
Yori and Supo. It's quite it's very interesting, and then it's very also explaining. Yeah, I can hear you. Yes, exactly. That's what I'm doing. It's very important for people to understand the dynamics.
Oh, okay. The line, I think data is constricting, the bandwidth thing. But Femi raised an interesting point from Ibadan, and it's not an unknown point. Now, Femi, I don't think, from the way he was speaking, he's, among the unknowing who say, nah, I know that. He actually said that I am aware that it exists. But perhaps perhaps the danger is being exaggerated. Now, that right there is the point that needs to be addressed. Femi wasn't able to, because we didn't have the time, comment fully on the whole matter about, because he compared that if the UK had 365 cases, if the US had 365 cases, do you think they would shut down? But we don't have the kind of facilities that they have to test. Our people are telling us of our constraints. Look, if we could test 1 million cases a day, for example, just so that we can talk about it, if we could test 1 million cases a day, nobody would have 365 death cases. In the meantime, Blessing has called in. Is that Blessing in Ajah? Good morning.
Good morning, Mr. Yori.
Good morning, ma'am.
What Mr. Femi has just said, God will forgive us and God will have mercy on us in Nigeria. Because so many times they told us that our environment, even assisting, helping us in this COVID-19. Is it because people are not falling down, dying around us? That is why we think, you see, we are the one that is even contradicting ourselves. The doctors is there. Me, I'm not doctor, and I believe Mr. Femi is not doctor. They are telling us that they've not tested enough. That means if they've tested enough, we will have enough people. For the mere fact that people are not dying, that does not mean that we don't know. The people that the thing happened to their family, can they pick call and say that they are hiking the number?
Exactly. When you say people are not dying, people actually are dying.
No, the people that the thing affects their family,
but
that they are dead.
Exactly.
The people will pick call now and say that they are hiking the number. When you see the way those things are happening, you will not come because we have the opportunity, because we have the grace that the thing has not happened to us. That does not mean that it's not happening.
Indeed.
Do you know how many doctors they say they infect this disease in Nigeria?
Yeah. Doctors are on the first line.
Any of the doctors can come out, any of their family will come out that they are hacking the number.
Okay. Yeah.
God will have mercy on us. So.
Thank you very much, Blessing. It's an interesting conversation. It's a debate, and Femi put it from his own point of view. But you can't challenge the fact that you cannot compare the numbers we are getting with the numbers they're getting in the US because the
yeah,
methodology is different.
Even
the samples are different.
Even South Africa, they have almost 108,000 cases.
Yeah.
But and the number of deaths is about 700 plus.
Yes.
You know.
Yes.
And they are testing more than we are.
So people have to factor that in.
That is it. So if is the more you test, the more you know. Oh, this person is symptomatic.
And as Blessing says, is it because it's not happening to somebody right next to you?
You know.
Did I get notification? Mazi Okoroafo, good morning, sir.
Good morning, sir.
Are we taking this thing seriously enough or not?
Sir, you see, the testing you are talking, or not testing, it does not matter. What we are saying now is that the National Orientation Agency, they have not done enough for us. Why am I saying this thing? Do you know, as you have rightly said in your comment, that people are still believing that this is a scam? You ask yourself, how many communities or town hall meetings have they called the whole of 774 local government we have in this country? How many? There is nothing. That is why you see all these loopholes about the people moving from one state to another state to another local government. And thank God that we didn't see people falling on the road as we used to, because in Ecuador, people were falling as when they die, people will just bring them and keep them on the road. What will happen? They will just go to a big man's house and drop it at the gate there. Is the Ministry of Health or Environmental parking this? Thank God something does not happen in Nigeria.
Wait a minute, Mazi, before I miss you, because you have a formula, suddenly you're going to say, thank you very much. So before you get to that stage, tell me about Abia State and the sudden rise in cases. You're going to be our reporter today. What can you tell us?
Now, listen, let me tell you what is happening in Abia State. That from the world go. Since February, I've been telling you that people in Abia State does not believe that coronavirus exists. Let me give you an example.
Your governor, I believe, is in isolation. Your governor is in isolation.
Listen, I said, sister, what is happening with you? The way you are coughing, the way you have cold, or they say that he's coughing, she asks us, okay, have you gone go to the hospital? He said, no, that she's going to pharmacy. Now, people, as I'm talking to you, people in the community are still going to the market up to today as I'm talking to you, which means in some area people still travel from Ohofia to Aro, from Aro to Omahia, Araba. They are still doing their business. At the end of the day, what happened? They will tell you that is government going to feed them? Is government going to give them palliative? Now, what are they going to do? They see that. So people are still going to the front. That is the issue. That's why I'm saying that the community awareness is not there.
Okay.
And nobody's doing anything.
I think that's responsible for the
station agents that have all their state officers, village officers in all the local. Where are they? Nothing. People still go and do their normal business up to as I'm talking to you in Abia State.
All right, I'm going to have to let go of you, Mazi. Thank you very much for being our reporter for a few seconds there and telling us the attitude is really no different from other places in Nigeria. Dr. Mebaodu, of course, we have to end up with you. We have a crisis still.
You can hear me?
Yes, we can hear you, Dr. Mebaodu.
Can you hear me?
We're about...
let me say this clearly.
Sure. Briefly, please.
Hello?
Briefly. We're about to close.
No, we need to do more in terms of information. We need to do more in terms of information. We need to do more in terms of information. That is exactly what is going to help us to deal with this gap. Individuals need to take responsibility, and government must enhance individuals to take those responsibilities. Okay. Take responsibility to make sure you are alive. I mean, we can't say it more than that.
All right, thank you very much. That's a fine place to leave it, Dr. Tuyi Mebaodu, and we appreciate you as always for coming on and giving us, a knowledgeable background to all these old wives' tales and some of those notions that we have. So everybody seems to be agreed that you got to take personal responsibility. We thank all the guys who called in. Thank you to Dr. Mebaodu and the other callers. No way around the fact. We've got to take responsibility. Somebody was talking about the National Orientation Agency.
So it's left for them.
Orientate yourself
first.
Go ahead and do that so that government will come on later on. But take responsibility in the first instance. That's our program today. On behalf of Asuko, James, and I, do please stay safe. Join us tomorrow for a fresh edition. I'm Yori Fulani. Bye-bye for now.